Our philosophy here at St. Vincent Healthcare, at the Pediatric Specialty Clinic here at St. Vincent's, is really trying to treat the whole child. And I think with pediatrics in general, there's really a trend to try to address this. And I think it's ever more important with pediatric disease and pediatric GI disease, because it's not just a tummy ache. It affects their schooling, it can affect their growth, it can affect their nutrition. And so really addressing the patient as a whole and the family as a whole. What we deal with in pediatric GI are diseases of the entire digestive tract and the organs that are related to it. So everything starting from the esophagus, stomach, small and large intestine, as well as the liver and the pancreas. We have a lot of resources here available now that weren't here before that help us in the treatment side of things. We have child life specialists, which is a specialty that deals with helping the child and the family cope with procedures that need to be performed. If they need to be admitted to the hospital, they're there to kind of facilitate that and just sort of help give coping techniques to the family and the child, and also to I think help them get a handle on their disease and what's going on. So one of the recent advancements in GI diagnostic technology that's come about in the last few years is something called Capsule endoscopy, or the camera pill, and it pretty much is as it sounds. It's a little camera device in a pill that the child swallows, or can be placed endoscopically, and it essentially makes a movie of the intestinal tract, looking for things like Crohn's disease, other inflammation, other sources of bleeding, things of that nature. And the technology has come a long way. The pill's gotten smaller, the pictures have gotten better, so it's a great diagnostic tool that we offer here at St. Vincent, and we're able to sometimes get to areas of the intestine that we weren't able to get to before. There are challenges with children, though, especially when they start to become aware of their peer group and not wanting to be different. And so I think that special care needs to be taken, and you need somebody who is familiar with that scenario to be treating those type of conditions. Having celiac disease and being gluten-free for the better part of 16, 17 years, I think it definitely helps me to understand where the patients are coming from, because I first remember when I went gluten-free and those difficult experiences to where I'm at now, and how it doesn't faze me at all, and that there's sort of light at the end of the tunnel for patients such as that, or who are suffering from other GI diseases.